A Unisa report authored by women says that black, impoverished, HIV-positive women bear the brunt of forced and coerced sterilisation in the country. The research has called for an end to the practice, saying it disregarded the women's humanity and violated their socio-cultural identities as women and mothers. For more about this report, we're joined virtually by Unisa's Vice Principal for Research, Postgraduate Studies, Innovation and Commercialisation, Professor Thenjiwe Meyiwa, who is also the co-author of this report. Professor, thank you very, very much for joining us here on Morning Live.
Good morning, Leanne, and to your viewers.
This is a frightening study, it really is. I mean, when we read about sterilisation in a time like this, perhaps maybe we can start off by talking about this Unisa study on HIV-positive women in South Africa that are forced and coerced into sterilisation.
Certainly. I must start off by thanking the women who raised their voices, afforded us to get into their homes, get into their lives, and share with us the lived experiences that they have there. And of course, the human rights that is pioneered by Her Rights Initiatives. This is an organization that is looking after these women and fighting for them. This study is about ensuring that there is accountability, ensuring that the policy reform, and just bringing out there this awareness that these atrocities continue to happen in a country like ours.
I mean, this practice, for how long has it been going? Obviously, it's since post-apartheid South Africa that we're focusing in on here.
Certainly. I'm not going to go back, Leanne, to the pre-democracy time. But what we have, the studies have been conducted, and we are aware, some of which have been from the University of KwaZulu-Natal, as well as the Commission on Gender Equality. But from 1997, we are aware that this has been happening, where we began to have cases being brought forward. But our study was conducted from 2021, and we now have a report. With the difference in this report relative to the previous studies is that it covers 6 provinces, unlike the previous studies that covered 2 provinces. And you can tell that this is widespread, and this is continuing, and we are calling that it should stop.
Yeah, and the reality is that this should not be happening in this day and age. I mean, how do we stop it from happening? Because, you know, this is a massive issue from what I'm gathering from the study that you've done. And are you able to tell us how many women are actually being forced to do this?
You know, with the number of HIV-positive women that are in millions, we were able to get 91 women, which is a big number. Even if it was half of that, it is alarming. But this is in 6 provinces that we got to draw the women experiences from. It is indeed widespread, and it does indicate that this is quite widespread, and it should be stopping, but it seems it is continuing.
Yeah. Who's behind this? Because that perhaps maybe can help us a little bit understand it. I mean, it's a troubling practice. It violates dignity, autonomy, and reproductive rights of HIV-positive women in South Africa. Who's doing it?
In our study, we're not just only looking at the officials in the healthcare system, but of course, it is them who are at the foot of this in terms of being at the coal face. This is healthcare practitioners and officials. These are doctors, these are nurses, these are clinics, these are places that you will think they should be supporting women. You will think that they're actually there to care for them. But besides that, in the report, what we point out is that we cannot leave out the policymakers, we cannot leave out the institutions' leaders, because they are the ones who craft these policies. They are the ones who should be overseeing this. We are lamenting the fact that what is being happening, continuing to happen, is the fact that the reproductive rights are being violated at the altar of the control of women's bodies, at the altar of controlling the number of HIV positive people at the altar of just not caring about, in particular, as the study is about and has found that mostly it is Black, poor, vulnerable women that are at the brunt of this.
Affected by this. You actually have spoken and interviewed some of the victims. Perhaps maybe you can highlight one or two stories in terms of what they went through, what it's been like for them, and how this sterilization actually took place.
From the voices of the women, what is happening actually, which is what the study is looking at, is the impact, the effect of this practice, and the fact that it's systemic. What women are saying is that they will go to a health facility because they're pregnant and they want to be attended to. Now, when they discover that they have HIV, what happens is that there will be, without consent, informed consent, they will be sterilized. And at most, it will be either they're coerced into doing that without understanding what's happening, with not their language being used, or just forced to it. Now, being forced here in our analysis is that we're saying they didn't even know that while they're going to these facilities for maternity reasons or for contraception purposes, they get to be sterilized.
And this is something, I mean, I'm reading a story of a lady who, you know, she documented her story a while back, and just saying that she went in for a normal gynecological operation and walked out and told that because she was HIV positive, they wouldn't operate on her unless she was sterilized. And then it happened, and she doesn't know till today whether this was because of the doctor, because of the hospital's management, because of policy, but the bottom line is she was judged because of her status of being HIV positive. And surely there are laws against this in the country. And surely this is absolutely not allowed.
Certainly. Even before the country, there are international laws that this country has signed for, that they've codified. We are a country that is a signatory to these laws, but despite that, this is continuing. There are even the laws within the country, one of which is we also, in the report, saying that it must be reviewed, it must be overhauled, which is a law on sterilization. But that law says nothing about HIV positive women, talks nothing about the vulnerable communities. So all in all, this happens in a context where there's law that exists, there's law that we've signed for, that we should be subscribing, and also ensuring that it's being kept.
And this is the thing, it's also cultural beliefs, and that's something that needs to be addressed urgently, because this is taking the rights away from women. And as you say, I mean, this is not a legal practice, which is devastating for the women that have to live with this, and many don't speak about it. I mean, as much as you conduct studies, I imagine that this is just a drop in the ocean as to what the real picture actually looks like out there, because women feel embarrassed to speak about this and keep it to themselves.
You are on the ball there, Leah.
Yeah.
They are embarrassed about it because of, as I say, most of them are Black women. And in our cultures within the country, we know that if you cannot mother, or if you cannot give a boy child, from just that you're ostracized. You may even lose your marriage. You may not even got to be married. You actually are referred to in the Zulu language, my language, Inyu, or as a barren person, you are infertile, and therefore you'll even be excluded from some practices within the family, within the clan, within the community. So all in all, it goes beyond just the torture, the violence by the health professionals on the women's bodies. It gets into the personal lives, in their homes, in open spaces, and also in their communities, wherein they get to be stigmatized. It is double stigmatization, because now you are not able to produce children, but also because of the stigma, because of your inability to be a mother, you find yourself now being double stigmatized.
I mean, the more I sort of read about these stories, the more devastating it becomes. I mean, I'm listening to or reading a story about, this is a good couple of years ago, but a young girl, this was written about 4 years ago. This was a lady who spoke to Broadcasting House, the BBC, and basically saying that she was sterilized without her consent after she gave birth at the age of 17, and only learnt about it 11 years later when she tried to have another child, where they basically removed her womb because they refused. This was in hospital. She didn't even know about this. I mean, these are devastating stories.
Certainly, it is devastating. But beyond that, you will find that even some of the women that we found that actually gotten stories from is that they're also disabled children.
Yeah.
The disabled children who would have been affected during the sterilization or during them giving birth because of this health professionals' just complicity in terms of just wanting to be doing what their masters, what their leaders within the institution expect of them. Even the doctors, you will expect that because there's this ethical code that they should have adhered to, but it's not done. Once they see this woman who's Black, who's from a marginalized community, and who's at times can't even understand the language that they're using, they have this right to take over her life and demand and get away to be the people who are the masters now of her life.
Just as we wrap this up, obviously victims have spoken out. Is there some form of reform or some kind of anything that can come in their way after being so brave to actually participate in this kind of study?
What we are recommending in the study, we have a set of recommendations, amongst which is indeed not just only policy reform, not just only wanting to put this awareness across the country, but also the fact that we need to have accountability. There must be repercussions, there must be consequences for those that did this, but also from the state's point of view, there should be programs that support these women who see them. I must tell you that we regard them as disabled from the point of view that they cannot be hired. Some of them have bled for so many years, and some of them cannot be employed because of the mental state in which they are in. So they are affected in many ways. So we look into and have spoken to some senior officials in the social development department to come up with programs to support these women. It was none of the grants, for instance, that we have look into these kinds of atrocities and violence on this particular group of women.
All right, let's leave it there. Thank you so much for talking to us this morning, Professor Thenjiwe Meyiwa. This is, of course, Unisa's Vice Principal for Research and the report's co-author on forced and coerced sterilisation of HIV-positive women.